Welcome to the buffet.
Thank you. Thank you for having me. I'm so
Pleasure.
excited.
So am I. Come in.
Okay.
So April, if you'd like to get on the couch,
Sure.
head on the cushion, we're going to do a lovely core therapy. Have you had core before?
No.
No. So with core therapy, we start off by doing some kinesiology, which is muscle testing, to find out what the body is telling me needs treating. Simply put, basically, I'm talking to your subconscious. I'm having a little chat with your inner self that you aren't aware of. That if I was to say to you, what are the root of all your problems? You would say, I'd have a guess, but I don't know. But kinesiology can find that out with physical, maybe even mental issues. So can you raise an arm for me, nice and straight? Lovely.
Sure.
I'm going to push here and you're going to hold up strong and hold. So don't let me push and hold. Okay, and the same with the other side and hold. Okay, got some weakness there. So can you raise a leg? I'm going to push here, you're going to hold up strong and hold. Okay, same with the other side. I'm going to push, you're going to hold up strong and hold. Okay, all right, there's something going on, but I'll get to the root of it. Can we raise this arm and this leg together? Just a bit lower than that? Yeah, I'm going to push with both and you're going to hold up strong and hold. Okay, and hold. Aha, you're strong that side, which is really interesting because both muscle tests separately weren't strong, but when they're together they were. How can that be? And it's your body telling me that this area of your back is okay, is good, but this area is not because it was weak. So I'm just going to have a little feel with a row of fingers to your sacroiliac and then raising arm and leg together and hold. No, okay, so I haven't got the right place, so I've just anchored you. Just relax, relax. Just going a little bit lower, raising again and hold. Hey! So what it is on your left hand side, lower down on the side of your sacrum. So here, this is you. This is your hips. This is your sacrum here. This is your left side. So on the side of your sacrum, on the inner side, here, where the back of your iliac crest meets the sacrum, there is a little separation there, okay? And it's intact on the other side because we found that the right side was strong, but it's just separating a little here, which sometimes can have an effect on the front as well, on the pubis symphysis, because if you like, there are 3 joints in the pelvic girdle. 2 at the back, 1 at the front, so I'll check that one out as well.
Okay.
Okay, so that was good. Let's have a look at the pelvis while I'm here. So just looking at your posture. You're higher on this side, on your right. Ribs are level. Pelvis is actually level, interestingly. Knees are good. So, no, this ankle is slightly dropped. So left ankle, right shoulder. So I'm just going to have a look at the pelvis and see what the kinesiology tests tell me. Raising an arm, I'm going to push and hold. That's good. So left iliac was good and hold. And try that one again and hold. No, okay, so right isn't. I'll look at that. And again and hold. No, okay, so it's slightly twisted and hold. All right, that side. So it's twisted down. Let's see what it's doing here and hold. Ah, that's good. Okay, so it's intact. can you put 2 fingers on your pubis symphysis bone, which is that hard bone, dead centre, quite low down, 2 fingers strongly on it, raising this arm again. I'm going to push here and hold. Nice, okay, so it's intact, that's a really good sign. Okay, so now can we raise this leg and this arm together at the same time? Okay, I'm going to push, you're going to hold. Can you just put your head back in the centre?
Yes.
Yeah, I'm going to push, you're going to hold and hold. No? Okay, let's try the other side and hold. No, okay, so there'll be a reason for that. Can you put 2 fingers there for me? 2 fingers there, lovely. And can you raise this arm again and this leg and hold? Oh, strong. Okay, so because you're anchoring your jaw, which is the TMJ, the temporomandibular joint, then that muscle test went strong. Right, can you put these fingers, the same 2 fingers, but on this side of the jaw, so these fingers on that
here.
side of the jaw. Yeah, perfect. In that jaw hinge there, just below the cheekbone.
Yes.
And then this arm again, and this leg again, and hold. Brilliant. There is no movement. That's so easy for you. So when you're supporting both sides, both of your, what we call a contralateral test, goes strong. Now we need to test with the other arm. So can you test with this arm on this side of the jaw?
Yes.
And arm and leg. Hold. Hey, strong. And then this arm. No,
Here.
sorry. This arm over here.
Yeah.
Perfect. And hold. Wow, all 4 of them. So the jaw hinge is responsible for a lot that can go wrong in the body. It's connected to the neck, so it can affect the neck, and if the neck is out, the pelvis will be out of alignment. So I'm going to just have a little feel of your jaw hinge and see what it's telling me.
Sure.
So feeling into that jaw hinge, the TMJ. That's it, letting it go. Feeling the connection. And becoming aware of how the jaw feels. This is the mandible bone, the bone that wraps round underneath our mouth, and the jaw, the chin, all the way up to the cheekbone on the sides. So letting it go, releasing any clamping, any tightness, any grinding. I've just got my thenar muscles of the base of the thumbs. That's it, it's moving now. So what I'm feeling is an energetic, slow, therapeutic sensation. It feels like there is a slow unwinding. If I could take my hands off, I'd be able to display what I'm feeling, maybe afterwards. But there's definitely this lovely feeling that the energy of this area is probably the Vishuddhi chakra, because it's right in the throat here, near this area. And sometimes with this energetic work, which is a type of TCM, traditional Chinese medicine, called Qigong, sometimes you may see colours behind your closed eyelids. And because I'm in the area near the throat and near the third eye, it could be blues or turquoises or purples. So now I'm sensing that the left is tighter than the right. The right has released. So just with that warmth of the muscle against the jaw, releasing that tension, letting it go, letting it go, letting it go. That's good. Swallowing really helps too. Sometimes it produces a yawn, and that really helps. Oh, I feel so much better already. So now we've done the TMJ, I'm going to retest your contralateral, which I think might be strong now. Let's have a look. So this arm and this leg and hold. Okay, not brilliant, it's better though. And then this arm and this leg and hold. Really strong. I mean, I can tell there's just no effort for you. So there's something, one of the joints here and one of the joints here, that is saying to me it needs attention. So let's have a look at the shoulder. Can you raise this arm for me on its own and hold? Okay, not great. Elbow and hold. That's good. Wrist and hold. Fine. Left hip and hold. Good. And left knee and hold. Nope. Ah, knee's coming up. Ankle and hold. Ankle is good. Right, so let's look at this shoulder first of all. Can you just rest that arm there, raising this arm up again and hold. Good. And then arm to here and hold. Good. And then arm next to your ear. Yeah. And hold. Lovely. And then arm up into the air in front of you and hold. Good. And then turning your arm round and hold. No effort. So that's with your thumb up. So there's something you're doing with your arm in front of you. It's not up here, but in front of you with the thumb up. It's not this way round, but this way. It's normally something like shutting a cupboard door or a door to a room, car door or dog lead. Quite often I get a lot of clients with a very strong dog. So I don't know, something like that. Knee came up. Give me this arm and hold. Fine. So it's not twisted that way. And hold. Lovely. Not twisted at all. And hold. Okay, so it's on the outside of the knee here. And hold. Good. Inside is fine. Just checking the lymph node. And hold. No. Okay, so lymph node as well. So I feel like you have done something to your knee where the lymph is raised and it's trying to drain the lymph away from the outside of the knee back to the lymph node at the back of the knee. So I'll treat it. I'm not sure what it is, but sometimes we're not even aware. Before a joint or an area of the body has a problem, it might be raised with things like lymph and white blood cells, or it might even be swollen a little. We're not even aware until it starts giving us pain. But hopefully we're before that stage and I've found it before it's a problem, but I'll still treat it. And I'm going to treat the shoulder. Right, next thing I want to know about, because on your consultation form you mentioned headaches.
Yes.
And they come monthly.
Yes.
Is it with a cycle?
No, not really. I think maybe when I'm too stressed or not eating properly, not drinking enough water.
Okay, so it's not necessarily the same day every month?
No, it's different.
It's random. And what type of headache is it? Is it across the eyes?
Yeah, I think it's more here on the forehead and mostly on the right side.
Okay.
Yeah.
Have you had an eye test?
An eye test? No, I had a surgery in 2016, I think.
Okay.
Yeah,
Surgery to do what?
because I had glasses for so long and I didn't
Right.
want to wear them anymore. So that's why I
Okay.
had a LASIK plus
Oh,
surgery.
yeah.
Yeah, I also had astigmatism,
Oh, did you?
so they corrected
I didn't know
this one too.
I didn't know they could correct astigmatism.
Yeah, they did.
It's interesting because you didn't put that on your form,
I'm sorry.
which is fine. But in the reflexology earlier, I found that both eyes were really solid. It felt on the feet, the reflex points, they just felt really static and there was no movement in them. And we worked on them and it
Yeah.
really got better. So I'm hoping that will help your eyes. I know that they probably feel fine, but they're probably still recovering from surgery.
Probably. So sometimes I do feel like a pressure or something in my eyes.
Oh,
Lately, not all the time,
okay.
but
Sometimes this can come from the neck as well, because actually the neck is very close to the very top of the neck is very close to the eyes, the C1, the top vertebra. So I will be giving you a neck release at the end of this core therapy.
perfect.
And that will also help. But I'm also going to, I think I'm going to work on your sphenoid bone. In fact, we're going to test it. The sphenoid is the bone that houses the eyes. It's got the eye sockets within it, and it goes from here to here, temple to temple. So I will be doing that. But before that, how's your stomach? How's your digestion?
It's good, I think normal, but lately I didn't eat so healthy, let's say. Like I didn't have 3 meals like I should, maybe just 1 or 2. I skip the meals. So I think that's why sometimes I have cramps or something lately.
Okay, all right. Can I have a little feel of your stomach? Is that
Sure.
okay?
Sure.
You all right if I just move your clothing? Okay. Sorry if my hands are chilly.
That's fine.
You're nice and warm.
That's fine.
You're on a heated bed though.
Exactly.
So I've got the hip point here and your umbilicus, your navel here, and halfway between the two here in a diagonal line, just underneath here, around about, is the ICV, the ileocecal valve. And this area is responsible for clearing congestion from the small intestine to the colon, the large intestine. So I'm just having a little feel. What this part of the body is telling me. You feel okay?
Yeah, I feel it maybe a little bit tender.
Mm-hmm. It feels quite intrusive, doesn't it? Deep. Can you put 2 fingers where my fingers are here?
Yeah.
And then give me a straight arm.
Okay.
Up here.
Oh.
And I'm going to push, you're going to hold up. And hold. Okay, little bit shaky, you can release now. So I feel that I want to release this ICV for you. So I'm just feeling into the tummy. I've got 2 thumbs, 3 nice deep breaths. And again.
It did hurt a little bit.
Mm-hmm. Okay, that's normal. You can bend your knees if that helps. And then I'm just massaging it. Are you okay?
Yes.
A bit sore. So that probably means that this area needed that to happen. And I can feel, it's right under my thumb now, I can feel where the pain is. So I'm just going to give it a little qigong. Directing that energy between my hands. And I'm visualising the ICV letting go, releasing its grip, releasing spasm. So when you're home in the shower, you can release this ICV yourself. And so it is halfway between the hip bone here and the navel in this diagonal line. It's about halfway, just underneath. And get to know it, be its friend. So don't go in too firm that it's going to hurt you, but just do the right amount of pressure that will release that in the correct direction. So you always want to be pushing it down and outwards towards the ICV. If you could do it every day, your stomach and your digestion would be so much better.
Every day?
Every day in the shower.
Okay.
I mean, it's just one movement.
Exactly.
Yeah. It takes like 10 seconds.
Okay,
Yeah.
I will try.
Yeah, no, it would make a big difference because of the cramps that you're getting. Okay, so we're going to retest it now. So can you put 2 fingers back here? Give me this straight arm again and hold. Hey.
It's much better.
Fine. And have a little feel yourself. Does it feel better now where I
Yeah.
go deeper?
Yeah, I don't feel so much pressure like before.
Yeah, great. Good. Now I'm going to treat the knee, the shoulder, headaches, sacrum that came up right at the start. But I think I'm happy for you to turn over now. Having a little feel of the spine. So it was the left sacroiliac joint that was out of alignment earlier. There was a little separation there, so that was the other side, which I'll come to. Just pushing down on the sacrum. And this movement is called Tuina, which is a Chinese TCM technique to help soften and move the spine, which then creates flow, warmth and qi through the whole body. So we've got some tightness here. You can probably feel that, April, can you?
Yes.
It's interesting, the rest of the spine is moving really well. Lumbar, lower thoracics. Yeah, it just starts to go tight here. Yeah, I can feel that. And then mid-thoracics here, so that's about T8, maybe T9. Yeah, and quite tight. And then it goes loose again up here. Fascinating. The neck I will work on far more later on. Then into the shoulder scapulae and the fascia around it. You okay?
Yes.
Is this feeling all right?
Yes, it is. It's wonderful.
So this is the side that wasn't happy earlier. I can feel it. It's there.
Oh yeah.
Yeah, yeah. So quite often we're tense here because of over tight glute maxes, and that will have an effect on the neck and vice versa. So if the neck is out of alignment, then the glute maxes will be as well. They'll need some love and TLC, some repatterning to make them soften. And then feeling into the sacrum itself, pushing right on top of it, and the edge. And the lumbar, lovely rocking, beautiful. Tight here, but it is coming better. Oh yeah, you do feel warm.
Oh.
Ow.
So that area feels tense.
It feels really tight here.
Yeah.
So we're going to open up these vertebrae here by doing a wing stretch. Just let your arm go. Floppy, floppy. Let it go, nice and heavy. Loose, loose. Beautiful. Okay. And loose again, releasing it. Lovely. Okay. Lovely. So picking up that scapula, circling it, just loosen it again. That's it. And then letting it stretch. Nice and rosy now. And then bringing the shoulder down while pushing the fascia up. Right, that will help loosen these vertebrae here. We'll do the same this side. Great, that's much better. And loose. A bit better. Working all the way down to the coccyx. So the fact that these hips are moving so well will also help the rest of the back. Eventually that movement and softness will reverberate all the way up the spine. It's definitely helping the sacrum and the lumbar, the lower thoracics. Yeah, it's tight from here upwards. Okay, I'm going to spend more time here. So this is rocking each vertebra left to right and down and back. You okay?
Yeah, it's more painful on the left side.
I can feel that. It starts about here, doesn't it? It's about bra line. Is it too much?
No. think this time was better.
That's good. Still a bit tight down here. But I'm really pleased about this part of the spine. That's good. Well, you've got nice and rosy now. That's a really good sign. Because blood flow is all about chi and life. And if there's blood flow, that's good. There's health. Lovely. Oh, that is so much better. Wonderful. Okay. So pushing into the ankle, the kidney point and the acupressure point, bringing the foot right out and thus raising the opposite hip. Lovely, really good. And April's being nice and relaxed, letting the energy flow, bouncing that hip. Beautiful. Rotating the toe to release any pressure on the neck. Bouncing that shoulder down, that toe pad, and then down the thyroid, reflex point, and from the kidney point all the way down to flush out. Releasing the foot, circling that shoulder area, separating it from the rest of the foot. Into kidney and acupressure point, holding, pushing in, locking, tilting out. Oh, it's tighter this side. Okay, letting go, letting the buttocks go, letting the hamstrings and knees. Lovely, that's good. Whew. Letting it go. And releasing. And I'm just going to do a double leg repatterning. Nice, beautiful, beautiful and trusting. And down. Qigong energy balancing the sacral float. Feeling the cerebral spinal fluid pulse up and down the spine. Again, there may be colours seen behind closed eyelids. More likely colours of red and orange, but many can be seen as the rebalancing occurs. top and bottom of the spine. Feeling that release of energy from the sacrum up the whole spinal column, passing the chakras of the Kundalini line of energies up into the head, and then release, 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 release. Oh, left ankle's flicking. Can you feel that?
Mm-hmm.
Let's have a feel of that ankle. Yeah, it feels all right now. So I need to treat the left outside of the knee. Bit sore there?
No, not really.
Good, okay. Okay. I want to have a look at hip. Nice movement. And let's look at this shoulder. Doing an arm repatterning. I can't tell if it's your stomach or mine now.
I think it's both.
An orchestra. Might as well treat this one. I like treating both sides. Oh, clicky elbow.
Yeah.
Ooh, get my fingers into there. Yep. That's it, lovely. Ooh, elbow stop flicking. Ooh,
Other
both
flick.
now. Wrist and elbow. Oh, okay, we'll get rid of that. Ooh.
Still clicking.
Gosh. Give it some tweener. There we go. Ooh.
Yeah. This was me, I think.
Yeah. Fingers in a row. That's it. Let go, let go, let go. Beautiful. Okay, so I'm feeling into the very base of the cranium, the occiput. There should be a nice, if you like, a gap there before the C1, but this feels really tight, like they're touching. So I'm going to create some space which will help any potential headaches. And then bouncing the side of the vertebra from the left down to the right, moving each one and then moving into each spinal process. Yeah, this can feel quite sore, especially if you haven't had it done before.
No.
So letting go, letting go, letting the whole weight of the head just drop down to the couch, let it go, so that the spinal process can turn. Yeah. It's really sore, isn't it? I have it done to myself. I know what it's like. But without this, you know, if the neck can't turn properly, then everything that the neck houses, the circulation and lymph, all the glands, coming up nice and heavy, heavy, heavy. I've got you. A row of fingers under the occiput, letting your head tilt all the way back. Beautiful. Keep it going. Heavy, heavy, heavy. And this allows some space under the occiput and at the top of the spine so that the circulation and all the lymph can work properly, allowing a clear head. Letting it go heavy, 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 and then a neck stretch. Can be sore. And then pushing one shoulder down, hoping it's going to bounce back with each push, and then bringing the head around and away from that shoulder quite strongly. Same the other side. Picking up the trapezius, giving them some softness, and bringing the cushion back. I'm just going to feel into that sphenoid because this is the area that could be causing the headaches. Tuning into a very deep energy instantly. It feels so good. I can feel the vibration and resonance go deeply between my hands. So it feels like it's massaging the eyes and the bone that contains the orbital spheres. In between my hands, that beautiful area is softening and relaxing. There's a lovely warmth there as well.
Mm-hmm.
I've opened the window and I can hear my little waterfall outside. It's pretty.
Sounds beautiful. So relaxing.
Okay, taking 3 deep breaths and stretching through fingers and toes, palms and soles, and turning into wrists and ankles and shoulders, rolling them one way and the other, seeing how they respond, and then releasing your arms for a whole body stretch. Feeling good.
Very good.
So I'm just going to retest a couple of things that weren't happy at the start when we did those first kinesiology tests.
Perfect.
Can I have this arm and this leg?
Mm-hmm.
And hold.
Wonderful.
So easy. I can tell you, it's not an effort for you at all. And can we bring this arm up straight in front of you with the thumb up, and this arm up for me so I can test. I'm going to push here and hold. Fine. And that was the one that failed earlier. You can put that down. Then I'm going to test the outside of the left knee, arm up again and hold. Lovely. Easy. So good. And a couple of hip ones and then we're done. So, right aces and hold. Lovely. And a twist and hold. Fine. Absolutely fine. So you're all aligned, everything's working together as a team, and you should feel better when you're simply standing or walking. everything you're doing should just feel right. You feel good?
Very good. Thank you so much.
Oh, absolute pleasure. Thank you for coming.
Thank you.
So, welcome April, and I am so excited to give you an aromatherapy massage. We're going to do a back, neck, shoulder and scalp massage.
Yes, I'm excited about this too.
Yeah, okay. So this is the pièce de résistance of the day.
Yeah.
Because you've had all sorts today, and it's been tiring for you probably, but in a very relaxing way.
Yeah.
But I'm feeling great. I'm ready for this.
I'm ready too.
You're ready. Good. We're going to work out which essential oils to give you for your massage. And during the day, we have tested other oils for other treatments, but this might be different. And these oils are worth a bit of respect in that we ask them and we ask your body, is it time now? So tell me, how are you feeling now? Is there anything you want the oils to be working on? So for instance, tiredness or eye strain or headache or...
So I don't have any headaches right now. I'm a little bit tired, but I feel pretty good.
Okay. And normally I say to people that come for a massage later in the day, what have you got planned for the rest of the day? Because I can either make you nice and sleepy and relaxed, ready, for a very relaxing evening and go to bed, or do you need uplifting and brightening and refreshing?
Maybe refreshing because I have to spend a night at the hotel, and I have to take the dinner to have something else to do, so I need to be a little bit more fresh until I go to bed.
Okay, right. So I'm straight away thinking of the citrus fruits because of being fresher. There are other herbs and spices as well that are more uplifting, and these will be good physically as well as mentally because they help refresh and tone, but also really good for the circulatory system. And massage is all about circulation.
That's perfect.
I'm going to have a look at lemon and grapefruit and bergamot and maybe ginger again because it's nice and stimulating and spicy. Not so much the lavender and the sweet marjoram because they are very relaxing and you've had them today already. Maybe rosemary, basil, really good for clear-headedness actually. I think basil would be really good for you because of your eye strain and
Yeah, I forgot to tell you that I do feel some like a slight pressure maybe on my eyes.
Okay, yeah. Okay. Talk to me, oils, talk to me. Eucalyptus stagariana is lovely. I'll let you smell it in a minute. It's a lemon variety of eucalyptus. Oh, niuli, a bit like eucalyptus, gorgeous oil. I call them my friends and they're all talking to me right now. Raven Zara, again, light eucalyptus but different.
Any of the oils that can help me with the cough as well and with my voice.
Niuli, Raven Zara, eucalyptus.
Okay.
Black pepper, stimulating, more like the ginger. Oh, sweet orange, another citrus fruit. I mean, personally, I love petitgrain. It's a flower from a fruit tree, so it's fruity in that manner, but I like it because it's very light and floral and it mixes well with other oils. You're going to smell amazing, whatever mixture we come up with. Yeah. Well, we're not doing testing, so we are going to do some dowsing. Okay.
Okay.
Have you ever done this before?
No.
I'm asking this lovely dowser if it will work for you, and it's saying yes. So is that a yes? Yes. It's so strong. I am not doing that. It's doing it itself. So I'm going to ask it again. Show me a no. Starting slowly, and it's going in the opposite direction. So it's going anti-clockwise. I don't know if the camera can pick that up. But if I were to leave it longer, it would start circling. So what I'm going to do, I'm going to ask it to work for you. Okay. So beautiful dowser, you work for beautiful April. And I'd like you to tell me which 3 or 4 oils that we're going to mix together for a back, neck and shoulders. And first of all, if you could just direct yourself here we are. Okay, so there's a mixture here of top, middle and base notes. I think that's going to eucalyptus. Yeah, okay, so that's a yes. Okay, I'm going to use eucalyptus. What else shall we use? Get that out of the way. I think that's bergamot.
Mm-hmm.
Do you agree?
Yes.
Yeah.
Yeah.
Going clockwise over bergamot. Beautiful. We'll test them again when they're together. Make sure when they're together it's a good match. Lemon's coming out well. No. Oh, it's one here. Oh, it could be basil. Let's just see. I'm not sure. Just holding it over the basil. Yeah. Oh, wow. That is really strong. I did wonder if it was your oil, especially if you've got some eye strain. It really helps with clear-headedness. Yeah. Great before like an interview or an exam. Right. Let's see if these 3 are happy together. The only thing about these 3 are they're all top notes, and I would want at least a base or middle note there in order to fix them, to hold them together, because otherwise they're too volatile and they'll smell lovely for 5 minutes and then you won't smell them anymore. Yeah, I'm happy. I'm just wondering, this is the only base note I've pulled out, but I've got lots here. You can see all the blue ones are base notes. No, I'm not happy with ginger, so wonder which other base note would work. Maybe coriander, because we've just done an abdominal massage and coriander's seed is fantastic for abdominal. Okay, so I'm going to just test them all together because I think that was positive. We possibly will have 4 oils. Good, look at that shake. There's a lot of vibration there. Yeah, lovely. There you go, coriander, bergamot, basil and eucalyptus. So you've got a fruit, a herb, a tree and another herb spice, the coriander.
Okay, perfect.
So I'm just going to mix those together for you. In fact, I'm going to start off with coriander. Three drops.
3 drops from each.
I think more of coriander because all the other 3 are top notes and coriander is the fixer. So we'll go for they come out quickly, normally, top notes. We'll go for 2 of the others.
Okay.
A lot of people think that, I can smell it now, that basil is similar to aniseed, like a licorice smell.
No, I don't know.
No? So, very distinctive, like licorice all sorts. No? And some people don't like licorice, some people love licorice. It's one of those things, you either love it or hate it. So, can you show me the inner arm and have a little smell of that, see what you think?
I like it.
Oh, good. That's a relief.
It will keep me very fresh.
I think so.
Perfect.
Spicy and fresh.
Yeah.
So if in a moment you'd like to get yourself ready for the couch and put your face in the face hole, lie face down, and I'll make you all lovely warm and cosy with hot towels.
Sure. Thank you.
Oh, it smells divine. So the oil has been heating, it's just going on to your back. That feel okay?
Yeah, ticklish.
Ticklish? That better?
Yeah, it's better now.
So I'm just spreading the oil around your back. Oh my goodness, it smells amazing. If you want to raise your head briefly, I'm going to put a little bit under your nose so you can smell what I'm working with.
Oh, wow.
Can you smell that?
Yes.
Yeah, okay. Can you remember the 4 oils?
Let me think.
I don't know if I'd have been able to if I wasn't reading them.
Basil,
Yeah.
right?
Mm-hmm.
It was this, citrus or no?
Yes, bergamot, yes. The 2 Bs, basil and bergamot.
And 2 more.
So there was a spice and there was a tree. Shall I tell you?
Yes.
So the spice is coriander
Oh, yes.
and the tree is eucalyptus.
I wanted to say eucalyptus, but...
So eucalyptus and other families like that, like Ravensara, Niuli, myrrh, are all really good for the respiratory system. So you wanted a little bit of help with your cough, but actually the eyes are part of the respiratory system as well. So that lovely eucalyptus will be helping you breathe and send those clearing vibes through the whole respiratory system. Okay, April, 3 nice long breaths. Getting stronger each time. Stretching the spine from top to bottom. And then moving into a figure of 8, double-handed trapezius massage. Working over that upper muscle here, up and over the soft fascia to the front. Around those beautiful scapula. And then double thumbs, each side of the spine, again between the scapulae, up, pushing the fascia, up, over the neck, a nice stretch, and round. lovely effleurage coming down over the hips, hands meeting. Good pressure through the palms, fingers are very light. Up and over, touching the couch, round the whole shoulder, even coming round the front of the shoulders, and repeating. This is a move I particularly love. Beautiful rhythm round the edge of the scapula with the finger line, pushing over the fascia and round. Meanwhile, bringing the other hand, hooking over the spine and off. And you've got this lovely cross fascia. Where it doesn't force, it just encourages the muscle to let go and loosen. This will help any shoulder issue, whether it's the shoulder blade at the back, the shoulder point round here, or indeed the front of the shoulder at the rotator cuff. Coming round to the other side. Oh, that basil, amazing. And again, two long thumbs meeting at the centre, pushing against the vertebra of the thoracics. Up, using the whole thumb length, up to the crease and up to the occiput. Smoothing with an effleurage. Going to get some more oil. Your back is loving this oil. There's no more dryness in your back. Lovely, that's good. Oh, much better. Effleurage up, over and round. And now I'm going to use some petrissage with knuckles over the sacrum, the flat plate of bone that actually sits at an angle from the rest of the back. It's almost like an angled table. And it can take quite a lot of pressure, a good weight. And this is an area where toxins happily sit. So just trying to agitate them, encourage them to move away. And then splitting at the waist, the obliques, down and across. I'm actually coming up onto tiptoes in order to gain good access with my weight against this beautiful area. Splitting down the obliques all the way to the couch and round those beautiful hips. So this is the gluteus medius at the top here. And of course, every muscle works so hard for us every day, whether we're sitting, standing, exercising, walking, whatever we're doing. And you can see there's some redness there, some rosiness now, which is super, it's just what I need. The circulation to help me with this massage. This area can feel sore in some people if there are.
It is a little bit.
I thought it might be. I can feel it. So if there are toxins sitting there, then or stiffness, tightness, then it can feel sore. Is it too much for you? A little.
A little.
Okay.
More on the left side.
Interesting. Yeah, it has gone rosy that side. Okay. And then coming up to the ribs. So agitating the skin, the layers of skin, the fascia just underneath, in order to work on the lymph system. And of course, a massage is all about the lymph and the red blood cell circulations. And then finding the spine, finding areas between the ribs, and then with a line of fingers pushing over the scapula, the shoulder blade, and down towards the armpit, where there is the auxiliary lymph node, and that will eat away all the toxins in the upper part of the back. And then there are lots of other lymph nodes down the sides of the torso, which will do the same job. I'm not pushing too firmly. Lymph works very close to the surface of the skin, so I'm working fairly lightly. And again, a row of fingers. Nice and calmly and gently. And then up, sideways in a wave-like motion, overlapping hands. Moving from the inner to the outer parts of the back. And down the arm to the hand. Cute little tummy noises. It's a really good sign. It shows the body is really relaxing. It feels safe and comfortable. Effleurage. effleurage. Lightly down, back and arms, meeting at the sacrum and strongly up the back. And then bringing in my forearms, including the very top of the back. This area here can feel so nice when it's pushed up and over, because it's an area that is becoming more and more of an issue with people when we use our phones and laptops and we're looking down. This can go quite strong and tense, but also quite fatty, and we need this area to be massaged to lose that roundedness, but also bring in some flow and softness into the upper spine. Relaxing onto the forearms, upwards weight, and pushing the shoulders down. And then working each side of the spine with thumbs, with the breath. I think that's my tummy now, April. It's this detox I'm doing. I blame it on the detox. And that was yours. It's really good. It's a good sign. So thumb pressures each side of each vertebrae, all the way down to the sacrum, and then a line of fingers moving and catching up, pushing waste materials down to the inguinal lymph down in the groin area. And the same this side. And then a line of fingers on the right hand side. Moving and catching. Lovely. Up, over, round and back. And then knuckles from the sacrum over the lumbar, thoracics to the cervicals of the neck, and round and again. So I'll be working on the shoulders again, but from the front once April turns over. Would you like some hot socks?
Yes, please.
Yeah, I thought so. Nice.
Oh, they're very cozy.
And if you could bend your knees so I can just insert a little cushion underneath and then relax them down. Is that in the right place?
Yes.
Yeah? Okay, so when I come to do your scalp, April, would you like me to wash my hands of the oil, which I'm very happy to do, or shall I keep?
Yes, please.
Oh, okay, will do. Oil going on. I'm just going to bring this a little lower. There we are. Good neck stretch. Over the chest, shoulders, the neck, and a stretch. I'm just going to turn your head one way. Rolling the knuckles around under the shoulder point, the rotator cuff, around the back, around the back, softening that shoulder from the trapezius. It's really nice because the head is wanting to relieve its pressure and go really heavy, but also the neck is lengthening and turning more to the right. It's a really good sign, shows that trapezius is letting go. Nice and rosy. And then up the back of the neck to the side, and a stretch. While I'm here, I'm feeling into that sternocleidomastoid muscle, picking it up from underneath. And turning. Knuckling. Stretching with knuckles around the back. There's quite a lot of tightness here. And letting go as much as you can. I'm just going to hold the area for a little while, and that will encourage it to let go. At least our tummies are letting go. Gorgeous little noises. So bending the muscle, that helps to lengthen it, pushing it back and forward. It's really warm and rosy. And then up the neck, extending, and then feeling into the sternocleidomastoid, that lovely muscle that comes from the front of the neck to under each back of the ear. It's a bit sore there, so I'm picking it up and rolling it, helping it to lengthen and relax. And a stretch. And now pushing and going to stand up for a lovely neck lengthen. A beautiful neck stretch using 2 fingers each side of the spine and coming up nice and gently, extending the head up and away, stretching it as it comes down, and a beautiful tilt of the head as it comes back. And doing the same again. Getting my hand as low as possible, pushing on each side of the vertebra, extending it up and back. Shoulders down, neck long. And coming up again. One last time. It was really good. April's really relaxed and trusting me. I'm making a line of fingers, just like in a neck release of core therapy. Tilting the head back and just going to hold it for a moment. And a stretch. Pushing each shoulder down. And along. I'm going to move into a scalp massage. Just going to wash my hands first.
Sure, thank you.
Taking the head, using the thumbs on the temples, and massaging with fingers, palms and thumbs in a whole hand double palm massage. Picking up the head and letting it release. Encouraging the fascia, the skin and the soft tissue around the head to let go and loosen, so that the muscles are not gripping so tightly, allowing circulation to flow, which allows clear-headedness, lack of headaches and migraines, and easy thought, good memory, everything that we need for good cognition. And then palms to the top and back, and again circling. Temples. And then double thumbs over the center line and down, strongly pushing. 2 lines and strongly pushing. Working on the acupressure points, relaxing. It's so good for release and repattern. And then another 2 lines over the ears and round. Thumb pads. The ears. Fingers over the top, fingers behind, circling. The front and the back, the top and the lobe, the whole ear in a lovely circular fashion. Bringing it back and then pulling, stretching. And then a small 2-finger petrissage around the hairline. Continuing above the ears and behind. And then the line of the occiput with those 2 fingers quite strongly in order to release any tension remaining. And then some gentle hair pulling, grabbing sections and pulling, reminding tension to leave, dissipate. And some plucking.
Mm-hmm.
And then whole hand massaging, pulling over the shoulders, the neck, scalp, whole hand. Peace and tranquility. Peace in the body, peace in the mind, peace for the rest of the day. And keeping your eyes closed and taking 3 nice long breaths. And then taking your awareness down to hands and feet and gently stretching them out. Maybe turning into wrists and ankles. And turning your shoulders, rotating them in one direction and the other. And then if you feel like it, bringing your arms up over your head. Lovely. And your back. Open your eyes when you're ready. Do you feel okay?
I feel wonderful.
Oh, good.
Very fresh.
Yes, fresh, spicy, fruity, and herby.
Yeah, and you have magical hands.
Oh, thank you. Thank you. I do love what I do.
I think it's very important.
Essential. Okay, thank you for coming, April.
Thank you so much, and I hope to see you soon.
Okay, great.